Claire. Today we will be discussing how the focal knee joint cooling increases the quadriceps central activation ratio. This was written in 2009 by Pietrosimone and Ingersoll. To start off, we're going to cover a few terminologies and abbreviations that we need to know for this article. The most important one of these is going to be CAR, C-A-R. It's the central activation ratio. The best way to describe this is the voluntary activation of a muscle. So the recruitment of the motor units to produce the force that is going to be that contraction. Typically what we're thinking of is going to be along the lines of if somebody is able to, they're not super motivated to lift an object. Maybe they use 50% of their motor neurons. If they are super pumped up, they just listen to a great song, and they're ready to lift an object, maybe they recruit 75% of their motor neurons. Or if there's a mother that's been, that sees their child in danger and wants to run over and lift a heavy object off of their child, they may have that boost of adrenaline that gets them closer to 100% recruitment. That ratio is that CAR. The amount of motor neuron recruitments or motor unit recruitments that are able to be activated at any given time. The MVC is the maximum voluntary contraction. This is going to be the contraction of that quadriceps for this journal article. The FMVC and the FSIB are the forces that are produced. The FMVC is the force produced by that MVC of that quadriceps. The FSIB is the force produced by a superimposed burst contraction. And the superimposed burst contraction is a stimulation that is applied to the quadricep during that maximum voluntary contraction to produce that final boost of CAR, that voluntary activation. If you combine the FSIB and the FMVC, you get the peak force. A little bit of background that we know is that joint cooling can lead to an increase in the excitability of those motor neurons. We also know that quadriceps injuries tend to lead towards volitional activation deficits. So what we're really questioning is, do these motor neuron pool excitabilities translate into the increased neural activation of those muscles? The purpose of this specific journal is to evaluate the effects of a 20-minute focal knee injury or focal knee joint cooling treatment on the quadriceps CAR compared to a control condition in healthy participants over a 45-minute period. They tested 11 healthy adults, all within about 5 years of the 25-year-old range, all perfectly healthy with no prior history, no cold allergies and no Raynaud's phenomenon that is known. You can see the instrumentation. They did find the CAR by finding the FMVC over that peak force. And then they analyzed it with statistical analysis through Windows. The way they did this was they had the patient lie down with their dominant leg positioned at 70 degrees of knee flexions. There was then an electrode secured within that quadriceps muscles. The FSIB, that burst, was 125 volts in 10 train per second intervals. They had 3 submaximal bursts of 30 volts, 70 volts, and 100 volts that were administered with 3 isometric contractions, but those were performed prior to testing to acclimate the patient to the situation at hand. The maximum voluntary contraction, that FMVC, was recorded once that plateau was reached. So they had 2 practice maximal contractions just to acclimatize them to the scenario. And then the testing began. And once that plateau was reached, that was what was considered that FMVC. The participants were also monitored for isolated quadriceps activity. They were watched to make sure that they weren't using any sort of compensatory muscles or adjusting their position to allow for an easier contraction through biomechanics and compensation. The CAR testing, which was what was measured primarily for this study, what they did was they performed their isometric MVC at that 70 degrees of knee flexion with that superimposed stimulus of 125 volts after that MVC plateau was reached. The plateau was held for 3 to 4 seconds each time, and there was a minute to 3 minutes of rest between each trial to ensure a maximum contraction. The measurements were taken at pre-test, and then 20 minutes post-test, 30 minutes post-test, and 45 minutes post-test. The focal knee joint cooling was applied with the modality of a crushed ice bag. They were 2 1.5 liter bags that were applied both anterior and posterior to the knee. They were secured with an elastic bandage, adding also a bit of compression. These bags of ice were applied immediately after the car pre-testing, and they were allowed to stay on for 20 minutes. The results showed that the car was significantly higher after the focal knee joint cooling at both the 20-minute mark as well as the 45-minute mark. The 30-minute post-test difference was not statistically significant, though it did trend towards that. The MVCs following the focal knee joint cooling were significantly higher only at the 20-minute mark. Our conclusions were that at the 20-minute post-test, the MVCs were significantly higher following the 20-minute following focal joint cooling. The control and experimental group were both able to excite their motor neurons from that central nervous system. We call this a state change. In the 30-minute post-test, their reasoning between the control and experimental group is that the experimental group was still remaining highly excited due to that knee joint cooling. However, the control, the central nervous system at that control group was unable to decrease their state of nervous system back to those baseline values in that given amount of time. That just 10 minutes of recovery time did not allow that recovery. Or did not allow that decrease. At the 45-minute post-test, however, that central nervous system in that control group was again able to change from that low to high excitability state, and the experimental state was still at that high excitability due to that knee joint cooling. What this shows is that indicates why that 20 and 45-minute post-test were both considered statistically significant. The magnitude of increase in CAR at the 20 and 45-minute post-application was both statistically significant, but also clinically significant. What does this really mean for us as athletic trainers? Really, we want to be focused on that CAR, right? We know that the increased CAR may be due to increased recruitment of that newly available motor neurons due to the excitability. We also think that the MVC compared to the FSIB shows an increased central activation of those muscles with the newly available neurons. I will quote Pietrosimone one time, which is, I love this quote, which is, we found that the participants were able to utilize a greater amount of their quadriceps motor neuron pool or increase the firing rate of motor neurons following a 20-minute joint cooling intervention at 20 minutes and 45 minutes post-application compared with the control condition. It sums it up perfectly. It ties it in a nice little bow for us. What this means for our clinical practice is that focal cooling of a joint, not a muscle, but a joint, for 20 minutes prior to performing a therapeutic exercise will increase the adjacent muscle CAR for 45 minutes post-application. This will also increase the activation of inhibited musculature, which then improves the functional outcomes and decreases the risk of future injury. This indicates that we should be icing or using cryotherapy methods on these joints prior to activation of these muscle movements. I hope that you enjoyed this. Have a wonderful day.